So Mohs Micrographic surgery changed our way of managing skin cancer in a way that allows us to do two things. One, it allows us to make sure that we can see what we can't see. And what do we mean by that? Well, when you have something sampled or biopsied, in order to assess whether or not you have a skin cancer, that's sent off to a lab. They section it into what we call breadloaf sectioning. So you have a piece of tissue and you're just taking two-dimensional representations of a three-dimensional structure, and hopefully you have an adequate sample to give you a diagnosis. Well, the way we do that in Mohs surgery is different. Instead of imagining a bread loaf, we're taking that piece of skin that's removed, and if you imagine a piece of pie, the innards, the inner contents within the crust is what we're concerned with. We want to get all that skin cancer out, and then we want to look at the margin or the side perimeter and the deep part of that tissue and make sure that there's no tumor extensions beneath what the eye can see. So Mohs surgery is great because after we take that skin out, we can take it to our lab real time. We don't have to send it out. We can use our lab within our office in an ambulatory setting, outpatient, and we're able to freeze that tissue down, put those sections, two-dimensional sections that allow a 100% evaluation of that three-dimensional structure, and stain it and look at it under a microscope to make sure that there's no extensions beneath what the eye can see. If there are extensions, we know about it. The microscope tells us right then and there, and we go back and we only take what is necessary from the remaining defect. And how do we know where to go? Well, we real-time make a map to make sure that there's, we know precisely where that root of cancer is. So that's, in a nutshell, kind of the procedure. The technique is really making sure that we're able to precisely map out the trajectory of the cancer. Another analogy is really what you can see is the tree root and all of the tree trunk and all the roots that we see or that we don't see lurking beneath. We trust the microscope to tell us that information and make sure that everything is removed.